Due to our aging societies, hospitals, nursing homes, and other healthcare facilities are increasingly understaffed. Socially assisted robots can provide the physical, social, and emotional support that vulnerable demographics, such as the elderly, the disabled, and children, require. In this project, we combine research efforts in the fields of psychology, computer science, and rehabilitation robotics to develop innovative applications for socially assisted robots to be deployed as physical and mental therapy tools. We propose to model ways in which the robot could help fulfill its user needs in one or more of Maslow's hierarchy of needs, along with designing sound experiments to validate their performance. There are over 12,000 stroke patients every year only in Taiwan, with costs averaging at least $60,000 per patient. Stroke patients often lose extremity mobility, which can be recovered by physical therapy. However, physical therapy is extremely labor-intensive. By implementing the novel key points control methodology, we are developing an NDT rehabilitation robot. Observing the lower body joints and according to the paced tempo, the system introduces the proper force to incrementally improve the patient's mobility while reducing strain on caregivers and therapists. Preliminary results have shown that our system has a superior performance to the guidance of a therapist, as measured by the asymmetry of the swing phase. Furthermore, we are aiming to assess how the personality of the patient may affect the performance of the system, and how to customize the relationship between robot and patient to motivate the user to continue engaging in therapy. Dementia is one of the leading cases of death worldwide, with 131 million dementia patients projected by 2050. Using AI-enabled robotics, we are developing non-intrusive applications for the automated diagnosis and treatment of dementia. Alzheimer's disease is one of the most common types of dementia, and its cognitive effects are primarily reflected in the patient's verbal activity. For example, stuttering, repeating sentences, or long pauses. For early dementia diagnosis, we propose a data-driven technique using a novel feature sequence design and recurrent neural networks. The proposed methodology was tested on a 60-patient database with 30 healthy patients, resulting in an ROC curve score of 0.998, almost perfect classification, outperforming the current state-of-the-art. Reminiscence therapy is a psychosocial intervention commonly used in dementia treatment. It is based on the evocation and discussion of meaningful events in the patient's past using a variety of supporting materials, such as pictures or music. We have created a platform that can autonomously guide patients through a reminiscence session. Using deep convolutional neural networks, entities such as persons, objects, and events can be identified from the user's personal pictures. Using these entities and a common-sense knowledge base, the robot is able to generate and verbally express a series of questions that stimulate the user to recall the past. We are developing several data-driven key technologies that can help autonomous systems to better understand their users. For example, based on facial markers, we can not only classify the emotion that the user is feeling, but also the intensity of it. Another important factor in human-robot interaction is attention, which can be estimated by body language and facial expressions. Both of these technologies can help robots to modify the way they approach users in meaningful ways. We are training artificial agents to understand the values of people. Implementing theory of mind and neural networks with constructs of social, economic, or even political nature, we create agents that behave like people with specific values and train a robot to discriminate the nuances in behavior of each one. This technology then will be implemented to engage the user with a deep understanding of their motivations. According to research on interpersonal trust, people expose their vulnerabilities by self-disclosure, often accompanied by negative facial expressions. Using natural language understanding and preference learning, the robot can autonomously generate dialogue that displays empathy and goodwill to the user, promoting trust towards the robot. In collaboration with McKay Memorial Hospital, we will deploy a robot therapy intervention for the emotional support of long-term patients in the pediatric intensive care and oncology units. By analyzing the user's face, the robot can estimate their mood and, over time, learn which social interactions have a greater impact on the mood of the children. A preliminary study with 30 healthy children resulted in a significant decrease in negative affect.